If you're lucky enough to have a job with health insurance, you probably notice it's getting more expensive, and a new study confirms that for you. It finds this year's average premium for family coverage is more than $15,000.
That's up 9% from last year, and here to tell us why and what you can do about it is Ray Martin of CBS MoneyWatch. Ray, good to see you here this morning.
Good to see you.
These costs are staggering. People see these numbers. Why are they going up so much?
Yeah, health insurance companies are saying 3 reasons. They're saying it's because of health care reform here. You know, the new law required them to add dependents under the age of 26, remove pre-existing condition exclusions, and adding more preventative services like mammograms. Washington is pointing the finger the other way and saying, look, health insurance companies are being circumspect, increasing costs now because next year they're going to have to justify their cost increases. So they're running for these cost increases this year and putting on a larger cost increase. The reality also is that there are increased costs for providers, like prescription drug companies and hospitals are charging just increased costs here, and it's just impacting health insurance costs, health insurance premiums altogether.
In many ways, it's a perfect storm because there's never a good time to see a rise in prices, but this is, you know, probably one of the worst times for most folks given the economy. We saw prices rise last year. A lot of people saw that at open enrollment season, which we're about to embark upon.
Right.
So how do you combat these significant increases?
Yeah, people need a plan here. So when you're going into open enrollment in the next couple of weeks, here's some things you need to do. First, compare all your plans and deductibles and out-of-pocket costs. Look at the total services that you'll use, what you'll pay for those, not just the premium. Just don't choose the lowest premium plan. You need to think about your total out-of-pocket costs for the whole year. Next, you're going to pay some out-of-pocket costs here, okay? 2/3 of folks pay something for doctor's visits, and 1/3 have a deductible at least $1,000. So look at a spending option that allows you to use pre-tax dollars, like a flexible spending account or a health savings account paired with a high deductible health plan. Next, think about piggybacking on your partner's plan. Many folks who have a spouse that work at another company might have a cheaper health insurance option. So if you move over to that, the net cost could be a savings of a couple $100s a month. And also look at a domestic partner's rider there. You know, you can be in a same-sex or opposite-sex relationship, not married, and still be covered as a dependent now because that's a new feature. And finally, consider trade group benefits. If you're a member of an association, alumni group, you might be able to get cheaper health insurance benefits there versus your employer, because some employers are impacted by the claims experience they have with 1 or 2 employees, and their costs have gone up 10–20% or more. So think about that.
Okay, those are the things you should do. Let's spin it around now. What are the things that you shouldn't do?
Okay. All right, don't coast on the same plan. Don't just stick with the same plan you had last year because it's in your comfort zone. You might find that your healthcare utilization and the benefits that you're offered have changed significantly. Think about how you're using these for next year. Also, don't go out of network. You got to make sure all the providers you use are in the network of the plan you have, because you will pay dearly if you don't. And lastly, don't gamble on your health insurance option here. Okay, don't just choose the lowest cost premium plan. You got to think about the services you use. But if you're younger and healthier and your healthcare utilization isn't that much, you might consider a high deductible health plan paired with a health savings account. That is one of the best options for younger and healthy folks out there, one of the best values.
And the good thing too is most of the times you can ask your employer and they will do their best to help you clarify in that open enrollment period. So hopefully you'll have some of those Q&As too, and if not, you've always got Ray Martin, right?
That's right.
You're welcome.
At CBSMoneyWatch.com, Ray, thanks.